I've decided to make a video for you of the different types of movement, which is the very last slide on the skeletal lecture. And the reason that I've decided to do that is that I think it's difficult to look at pictures of the movement and really get a good idea of what these movements typically are doing. It's nice to see a movement in action. The first thing I want to say is to keep in mind that whenever you're looking at these movements, it's always from anatomical position. Remember that this is anatomical position, okay, with the palms facing forward. So that's very important to keep in mind. Now the first two types of movement are flexion and extension. First off, we're going to do flexion of the forearm. Remember, flexion is when you're decreasing the angle between two bones. So as I flex my forearm, I'm decreasing the angle between the humerus and the radius and ulna. So again, this is flexion of the forearm, and this would be extension of the forearm, bringing it back to anatomical position. Now we can also do flexion of the arm or the upper arm, and if we're going to be doing that, this would be flexion of the upper arm. So flexion, for the most part, is mostly, again, bringing a part of your body more to the anterior, with the exception of the legs, and I'll talk about that in just a minute. So this would be flexion here of the forearm, extension of the forearm, and then here's flexion of the arm, or the upper arm, and now extension, bringing us back to anatomical position, and then anytime that we go past anatomical position, this would be hyperextension. Okay? So that's hyperextension. So again, here we have flexion of the upper arm, extension, and then hyperextension. Okay? So that goes over those movements on the arms. Now let's talk about on the legs. When you look at the legs, and you have to excuse me for a minute, I have to pull up my leg here. So when you look at the legs, when the leg's straight, that's anatomical position. So now to decrease the angle between the femur and the tibia and the fibula, we actually have to bend it posteriorly. So that's flexion, okay? Now, so this right here, when we're talking about flexing the lower leg, this movement here would be extension, and this is flexion. So extension, flexion. Now, if we were to talk about flexion of the hip, which I was doing as well because I had to pull my leg up, then that would be, again, let me go ahead and pull that down just a little bit so you can see that a little bit better. So flexion of the hip would be if you were to move your leg forward here. Okay, so that would be flexion of the flexion at the hip, or you could say flexion of the thigh, okay? And then extension would be bringing us back to anatomical position, and then hyperextension would be if you were to pull your leg behind you. So then the last two on that list, and I'm going to move myself back up here, the last two on that list are going to be dorsiflexion and plantar flexion, and that's going to have to do with, again, so you have to excuse me for my acrobats here, but that has to do with your foot. So when we talk about dorsiflexion, that's going to be pulling your foot back up, okay, towards the ceiling, and plantar flexion would be as if you're pointing your foot, and I always say you can remember this by picturing that you're pointing to a plant with your foot, plantar flexion. So that's dorsiflexion, plantar flexion. And then we have abduction and adduction. Abduction, okay, so abduction is going to be anytime that you pull something away from the trunk of the body. So here I'm abducting my arms, okay, if you can see that, that's abduction, okay. Now when I add them back to the body, that's adduction. So here, this movement is adduction, okay. So if you can picture you're doing jumping jacks, you're abducting, okay, both your arms and your legs, and then when you bring them back in, you're adducting, adducting. Then we have rotation and circumduction. Rotation has to do, again, typically when we use the word rotation, we will say we're rotating something medially or rotating something laterally. So this would be an example of rotation. If you look at the shoulder joint here, if you were to rotate the upper arm medially, we're going to rotate the arms medially. Okay? And then if I were to rotate the arms laterally, remember rotating medially means rotating towards the midline. If we were to rotate laterally, we would rotate this way. That's rotating laterally. So rotating medially, rotating laterally. Okay, that's rotation. Now, if we talk about circumduction, circumduction would be, again, if you were making a big circle, you can think of circle circumduction with your arm. So that covers those ones. Now, then we have pronation and supination, which are very easy. All you have to do is picture if you're holding a bowl of soup, that's supination with your palms up. Supination, there's pronation. So supination, like you're holding a bowl of soup, pronation. Then we have eversion and inversion, which has to do with your foot again. So you have to excuse me as I pull up my foot here. So inversion will be if you roll your foot in, okay? Eversion will be if you roll your foot out or roll your ankle out. So inversion, okay, roll it in, roll it out, that's eversion. Retraction and protraction has to do with your jaw. So I'm going to get nice and close here, and this is my most embarrassing movement that I'll show you. So if you're going to do protraction, protraction will be protruding your jaw out. So this would be protraction. And then if you're going to do retraction, retraction is bringing it back in. So retraction, protraction. So that's protraction, retraction. Protraction just means that you're moving some body part forward. As you push your jaw forward, that's protraction. And then there's elevation and depression, which is very easy. Obviously, depression is going to be bringing it down more inferiorly. So if I take my jaw, that would be depression. And if I move my jaw up, then that would be elevation. So there you go. There's all my acrobatics and my nice funny movements, all for you. So that way then hopefully this will help you in terms of understanding what these movements are. And as always, if you have any questions, you can always email me, or you can also write it on the discussion board, and that way then everyone gets an opportunity to read your question. All right, thank you.